Trauma systems are the people, the procedures, the structure and the services and the supervision that is necessary to save lives in the care of the injured. The history of trauma systems started with Florence Nightingale, where in the Crimea War she collected statistics about why people died and what could be done to improve their care. She reduced the mortality in the field from 40% to 7%. It's a spectacular example of quality control and data management. Presently, trauma systems research in Australia has demonstrated a dramatic improvement in preventable deaths.
For example, in the state of Victoria, with the introduction of the state trauma system in 2001, there was a comprehensive registry set up that measured the outcomes of patients not just when they left hospital after their severe injury, but also assessed down the track, 6 months, 12 months, 18 months, now 3 years after their injury. And we know not only that there is a 60% less chance of them dying once they've been severely injured, but also that their long-term outcomes, that is return to work, return to quality of life, reduction in pain, increase in function, have all increased over the months after they've discharged from hospital.
In war, most of the hospital systems and care breaks down. That's somewhat happening in trauma care too now with road traffic accidents. The attitude is that we can't care for it all, we'll just try and get by. There's also the philosophy that a person who gets involved in an accident is fulfilling Darwin's prediction, and that is, if you're incompetent or negligent, you'll get killed. So we'll just put up with that and let them pass on.
Some of the things that we can do to improve outcomes in trauma patient care relate to the system. That means relating to where those patients are taken to, which hospitals, and hospitals that have a special interest and enthusiasm for dealing with injured patients tend to do better than those that don't. But also the training of those people within institutions can contribute to the outcome in terms of trauma care mortality as well.
Polytrauma is a severe injury caused by high energy trauma, which involves multiple body systems and causing a high risk for death and potential complication. This is a type of injury which involves maybe head, chest, abdomen and extremities. But the most important thing, the combination of these injuries makes the patient very sick and high risk for potential complications such as organ failures of vital organs like heart, lungs, kidney or liver, and high risk for mortality. These injuries are best to manage in major trauma centers by specialist teams led by trauma surgeons.
There is an economic problem that we can't provide all health care to everyone, so there's a cut. One method is to provide the most junior staff member to look after the injured person. We're overcoming these prejudices by using our trauma system.
If you get those surgeons up to a better level of decision making, you can improve care for those patients and improve outcomes for those patients.
In summary, it's the care at the scene of the accident, the ambulance officers, the emergency department, surgeons, the trainees, the operating theatre, the anaesthetists, the intensive care, the rehabilitation, all working together in a seamless, positive manner.